Well, having a colonoscopy can be frightening any time of year. Well, since it's Halloween, we thought this would be the perfect time for Dr. Jason Mizell, a colorectal surgeon with Baptist Health, to come in and help take the scary out of your colonoscopy. Good morning, Dr. Mizell. Thank you so much for being here. So let's dive right in. What are those warning signs when a person should see a surgeon or gastroenterologist?
Yeah, so there are things to definitely be aware of. Things that we commonly think about is increasing abdominal pain, weight loss that is unintentional. Everybody wants weight loss, but when it's unintentional, that's scary. Whenever you start having or noticing blood in your stool or just significant changes in your normal, from your stool, or problems with like increasing nausea and vomiting, just things that are out of the ordinary, particularly related to your abdomen.
When should someone get a colonoscopy?
So the guidelines, if you're having no symptoms at all, would be 45. It used to be 50. It's been moved back up to 45 because we are seeing an increasing incidence in young people with colon cancer. So the guidelines have changed, so it's 45. But if you have a family history of someone in your family with colon cancer, then you would say 10 years before that. So if you have an aunt that's 55 years old or say 53 years old, then you would do 43 on your colonoscopy.
Someone who is 45 may be thinking, do I really need one? I know it's time, but do I really need one? What would you say to that?
So yes is the answer, which, I'm a colorectal surgeon, so obviously I'm gonna say yes, but it is interesting that colonoscopies studies have shown they are actually the best screening test for any sort of cancer. Like they're better than X-rays, they're better than mammograms. They are excellent tests because you can not only diagnose, but you can treat all in one procedure. And when they are done, they remove the cause of colon cancer. And then once it's done, then you're good for 5 to 10 years. So it's a very effective test. It's very quick. It's relatively cheap. So it's an excellent test. And so once you get it done, then you can just sit back and not have to do anything for several years. So
what are polyps, and then why is it important to address them?
So that is the key, is that when you have polyps in the colon, they get larger and they will turn into colon cancer. So polyps, when they're very small, don't cause symptoms. So that's when you should get a colonoscopy based on the guidelines. And then once you get the colonoscopy, we do it, we find these little small polyps, we completely remove them, and then there's no cancer because you have basically removed the root of why you would get colon cancer. So you remove the polyps when they're small, when you're not having symptoms, because if you wait till you're having symptoms, at that point, the polyp is too large. It may have actually turned into a tumor or a cancer. So that's the reason why we do them early.
So does everybody have polyps then, no matter what?
Not necessarily.
Okay.
It is about 30 to 40% of the population will have polyps to some degree. And the older we get, the more likely we are to get polyps. But whenever they're small, regardless of the age, you can always get them removed. And then that procedure is quick, it's easy, it's painless, you're asleep. So it's a really nice way to get it done.
If somebody does have blood in their stool, what do they need to do?
So the main thing would be talking to their primary care doctor, be usually the first step. If they're able to call a gastroenterologist's office, a colorectal surgeon like me, call Baptist Health, whatever, you can get in pretty quickly and let them know your symptoms, because that's something we don't take lightly. People get worried about insurance and paying for it, but when insurance companies see blood in stool, things like that, they pay for that. So you don't have to worry about doing that stuff out of pocket. And so we want you to see your primary care and get in the system quick to get this addressed.
Let's talk about prepping for a colonoscopy, because
Yes.
I've actually heard this is probably like the worst part of getting one. It's just before. So explain maybe your experience.
Okay, yes. So I have personally taken said prep, and it actually is not that bad. It used to be bad. I mean, it used to be a large gallon of stuff that was very salty. It was hard to get down. But some companies now come up with some much better preps that are smaller in volume. They split it up over, usually you take part of the prep, go to the bathroom for a while, you wait about 4 hours, you take the second half that is not as bad tasting as it used to be, and then you're pretty much done with that. So smaller volume, tastes better than it used to, and doesn't cause a lot of like pain or cramping. And once that's done, then you're nice and skinny, you're looking good, you're in the mirror, and then the next day is like your actual colonoscopy, and you're asleep for that whole thing.
Right.
And then afterwards, you're fine. So the prep is the worst part, but again, it's much better than it used to be, and it's relatively quick, and you can go on about your day after the colonoscopy's over. So.
Is there anything that we need to be doing like right now for colon health? Maybe things to eat specifically?
Yeah, that's great. Great question. So what we typically say is anything that's fried, greasy, low fiber, like those are the unhealthy, like scary foods, for the colon. The studies have shown that the more fiber, it's not 100% preventative, but the more fiber we do in our diet, the less we have like the processed foods, the less just straight red meat, the better. And that can apply also to things like diverticulitis and also just general constipation. So hemorrhoids, any kind of high fiber diet is a good treatment for pretty much all of those colon diseases. So you're definitely doing yourself good work with colon health, but also you're preventing a lot of other troubles as well.
Okay, and of course, there's a number on your screen. I guess that's the best way to reach out if people have questions.
Yes, then also you can go to baptist-health.com as well, and there's a list of providers on there, and you can look up specialty, you can look up names, lots of different ways to get in and get taken care of.
Perfect. I've got 15 more years before I have to have one, so thank you
Yes.
so much for coming in
Happy to help.
and talking about what I need to expect. Great
Yes.
information for me. Thank you.
Happy to help.